here. All right, welcome everyone. Welcome to the latest in this series of forums on COVID-19 and the vaccine. My name is Jerry Rosberg. I'm the host here for this session. Ordinarily, if you go to a hockey game, you know you have to wait to the end of the game to find out who the three stars are of the game. There's no waiting here in our forums. We already know who the three stars are. Can we just have the title slide here so that everyone can see who our speakers are going to be? Well, I will introduce them even without the slide. Here it comes. All right, so there's me as your host, but Donna Lynn is the University COVID Director and the star of many of these presentations. Wafa El-Sadr, University Professor. You've all had the pleasure of hearing her on many of these. And Melanie Burnitz, whose updated title is actually Senior Vice President and Director of Columbia Health, again, has been a star of many of these prior forums. We're dividing today's session into three segments. There's going to be a very brief overview. Then we have a new idea, something special that we're trying out today that is a quiz, an audience participation event that we hope you'll find interesting and engaging. And the third piece, and really the bulk of the session, is a Q&A, an opportunity to hear your questions, and we intend to get to as many of those questions as we possibly can. So my role, as I said, is to be the host. I hope you're old enough to understand this reference, but I see myself here as Ed McMahon getting to introduce our very own Johnny Carson, namely Donna Lynn. So without further ado, may I say, here's Donna.
Thanks, Jerry. I bet there's some people on the call that don't know that, but let's go to the slides. As Jerry said, what I want to do is just provide maybe less than a 10-minute framing and context for where we are in terms of COVID and also vaccines, including some interesting developments that have happened today. So you can go to the first slide. Go ahead. So just to give you some context, I think many of us would agree, my colleagues Wafa and Melanie and Jerry, that there is a perception in the United States and certainly here in New York that we are, it's important to start loosening some of the restrictions. And there's no question they have been challenging, but it's important for us to also understand that we still have a very serious problem when it comes to COVID. So to just give you a few numbers, we had over 5,000 people in New York State just on March 7th test positive. We had close to 5,000 people, not necessarily the same people at all, but we had 5,000 people in our hospitals due to COVID. And about 25% of them are in the ICU. On March 7th, 64 people died for causes related to COVID, the overwhelming majority of them here in New York City. And as I'll show you on another chart, our COVID positive rate in New York State is 4%. In New York, it's close to 6.5% to 7%. And as I said, I'll show you some peaks and some valleys that are important for us to reflect on. And nationally, some of the same phenomena is happening. But here in New York State, we're approaching 1.7 million COVID positive cases in the year since this has started. You can go to the next slide. And then we also know there's a lot of variation around the country. New York State ranks about in the middle of the pack. Our neighbor New Jersey is, and the higher you are, the worse you are in terms of your percentage. And there are a number of states that are more in the 1% to 2% range. You can go to the next slide. So this is what I was pointing out to you before, that since March of 2020, we have had some peaks and we have had some troughs. And look at the trough from June until really November, where our cases were in the 1% to 2% range. We had a peak in mid-January, shortly after the holidays. We've come down significantly, but the important thing to see is that leveling off of the trends, which is very concerning for everyone. Next slide, please. And then this just gives you a sense by zip code. You can take a look at this on our own Columbia website, as well as another slide that I'll show you, which is our COVID-19 website. And much of this is also available on the City of New York website. So the lighter the zip code area, the better you are in terms of your COVID positive case rate. And while that's true on the Upper West Side, for example, as you climb into Washington Heights and Inwood, those areas get much darker. Next slide, please. And then we'll spend some time and I'll direct some questions to Wafa and to Melanie about the variants, but the variants are becoming not only concerning for the past several months, but we do have some new variants, and we have one right here in New York called B.1.526. That variant is much newer than the others, which are the Brazil and the South Africa variants, as well as the UK variant. And this one in New York, one of our researchers, Dr. David Ho, and his team have been tracking that, and it has been increasing just since December in New York. And the concerning parts are, first, that it's resistant to treatment, and that there is some evidence that it's less receptive to the vaccine. And there are going to be more and more variants. Again, we'll talk about that later. Next slide. And then I want to just spend 2 minutes on what we're doing at Columbia. As you all know, if you're here on campus, there are a number of safety measures that are in place, but I want to focus on testing. You can go to the next slide. And so we've had a testing program since June 22nd. We've done 175,000 tests. These are for asymptomatic people. And we're very proud when you think back to the numbers I presented for New York State being at about 4%. And New York City being at 6.5, we have 0.3 just in the last week. You can go to the next slide. And that's a snapshot of our website that shows that 0.3%, how many people have been tested. But we also have a significant number of people in isolation because they have developed COVID, or they're in quarantine because of close proximity. You can go to the next slide. So the last thing I just want to touch on is our vaccine efforts. And there's a lot of interest around the vaccine. And as you know, the CDC sets guidance for what groups are eligible, but every single state then interprets that guidance and makes up their own rules. And so we are in a place where the governor's defined group 1. He hasn't defined group 2 and group 3 yet. But we now have a fairly expansive category of 12 million of our 18 plus million residents in New York State are actually eligible for the vaccine. Just today, he expanded this group. It used to be 65 years of age and older. Starting tomorrow morning, it will be 60 and over. There are a number of underlying health conditions, which I have listed here below. They're fairly broad. And so regardless of age, as long as you're 18, you can get vaccinated for these underlying medical conditions. There's a small group of people, 16 to 18, who can get the Pfizer vaccine. But for the most part, age 18 is sort of a cutoff point. And many people, as you can see in the 1B category, have contact with the public, and that's part of the rationale for giving them access to the vaccine, irrespective of their age category. The good news is, and Melanie and I will talk about this later, is that we have been now given approval to distribute the vaccine on our Columbia University sites. So up until next week, the only places you could get the vaccine would be hospitals, these mass vaccination sites the city runs, and some of the pharmacies were also authorized to do this. We think it's really important to bring the vaccine to our Columbia affiliates. And so by the end of the month, we will be in 4 locations at Columbia offering the vaccine free of charge to our affiliates as long as they meet the 1A and 1B categories on the Medical Center campus on 103rd Street and Broadway, at 51st Street, 51 West 51st Street, and on the Morningside campus in Lerner Hall. You can go to the next to the last page. I still have to remind people all the time, as you hear We don't have enough vaccine to vaccinate everybody that's eligible right now. But as you've heard the president say, the hope is that by May, that will we will be able to get through all groups that want the vaccine. We've got to reemphasize that you've got to follow Columbia rules around safety measures. And right now, by the way, and again, we'll get into this with WAFA to talk about the differences between the three vaccines, Pfizer, Moderna, and J&J. So we've done almost 9,600 first doses for our own affiliates, and we're catching up quickly in terms of the second doses. That's here at the medical center or NYP, but we literally believe there are thousands of others who have gotten the vaccine. And then the last slide before we turn to our quiz is that another development yesterday was that the CDC issued guidelines for vaccinated people. It's gotten a lot of press. First important thing to remind everybody is that it does not apply to healthcare locations. So if you work at the medical center, in a hospital, in a clinic, these do not apply to you. These are really, I guess I'll call them social gathering guidelines. They have not been adopted by New York yet. We will anticipate that we'll get some guidelines, but for now, we're pretty much status quo. And so you can see if you're vaccinated, both doses of the vaccine or Johnson & Johnson single dose after a period of time, you'll be able to interact with family members, with friends, as long as you meet some of these criteria, like if you are in a single household, even if the other people are not vaccinated. You have to still be careful and quarantine and test if you have any symptoms of COVID. So the reminder that the CDC provides is that despite having the vaccine, you need to still adhere to many of the prescribed safety measures, and you also have to adhere to what your employer is expressing. So your employer's policy may be different than the CDC or even the New York State guidelines in that they might be stricter, they can't be looser. So with that, I'm going to stop. And please feel free in the meantime to put questions into the Q&A box, which we'll get to, but we're now going to turn to our quiz. We have 7 questions that we thought we would ask the audience to answer. And so if we could put those up on the screen, and you will be able to indicate your answers, we'll display them and then talk a little bit about them. Thanks, everybody. I'll ask the man behind the screen if we are ready to close the quiz out and display some of the results, and then we'll provide a little bit of an explanation to each of the questions that were asked. All right, great. Well, this is good. So I'm going to turn actually to Melanie for the first question, if I could. Since January of 2021, COVID testing in the United States is increasing rapidly. 69% of you said it was true. And I have to tell you, 69% of you are, Melanie?
Wrong.
Wrong.
I worried for a minute I was going to get it wrong.
Great.
It's not increasing rapidly. We've actually seen plateauing and potentially a slight decrease in that testing numbers.
Great. It's, again, something that we should all be very concerned about.
However, I think a great reminder that we do have testing available here on campus. We, have several ways of testing, and there is the voluntary testing available. So we are lucky we're in a setting here where there is ready access to testing, and we actually have seen our testing numbers remain relatively consistent. So we are a little bit of an anomaly again. So thanks to everyone for participating in testing.
And actually, the additional good news is that New York City is staying also has not seen a decrease in testing as well. So I think New York City and Columbia are doing well in terms of maintaining testing rates.
Great. So question number 2, I'm going to ask WAFA to answer. Studies have shown that the Moderna and Pfizer vaccines do not work on the new COVID variants. 91% said that is false. WAFA, what's our answer?
The answer is that that we actually do not have data that support that they do not work against these COVID-19 variants. The only available data are just data that were done in the laboratories where some of the response to the vaccines, like the antibody response to the vaccines, that it might be produced by the vaccines appears to be a little bit attenuated in the test tube, but we have no evidence as of yet in terms of that these two vaccines do not work on the new COVID variants.
Great, thank you. Question number 3, we've got a little bit more of a dispute amongst the group. I'm going to answer this one. New York City's hospitalization rate is now among the lowest in the country. 38% said true. That is not correct. Actually, New York City's hospitalization rate is the worst in the country as of last week. So that roughly 5,000 people that we saw based on the population is in fact the lowest performing relative based on a survey that an organization called WalletHub performed. So we still have obviously some really big concerns about that. I'm going to turn to Wafa for the next one. Again, this one's a little bit of a tie. If I got a severe allergic reaction from the first dose, I should not get the second dose. Wafa.
Yes, that is true. If you severe allergic reaction, by this we mean immediately within half an hour, anaphylactic reaction after the first dose of a vaccine, the individual should not receive a second dose of that same vaccine.
All right. And I'm going to, 97% of the population better be right. Wafa, I'll turn to you on someone who has been vaccinated cannot get or spread COVID.
We have a very informed audience, and that's wonderful to see that. As you are well aware, all the vaccines that have been studied have looked at the effectiveness of these vaccines in preventing symptomatic COVID-19, but they have not been looked at in terms of preventing asymptomatic, meaning getting infected without symptoms. And I think that's the reason that we're still concerned and advocate that even vaccinated people should continue to wear masking and so on, so they don't inadvertently transmit it to somebody else.
Thank you, Wafa. And I'm going to turn to Melanie for the next two. So the first one, number 6, is failure to participate in the COVID test sampling means access to your computer will be shut off until you get a test.
So the 81% who answered false are correct. That is false. However, failure to participate in the sampling when you are called to participate means that you will lose access to campus. So you will get a red pass and your ID badge will be inactivated. You can still access your computer, but you won't be allowed into the building in order to do so. So we will, that sample is required if you're selected within the 2-week window, and failure to participate results in a red pass. The only way to get rid of that red pass is to come and get tested.
Great. And then the next one, if you're vaccinated, COVID testing will not be needed in the fall of 2021.
So our 90% got this right, because this is really an area that has not yet been determined. We really have a ways to go before we figure out the fall testing program in all its extremes. And we're just not there yet. You know, we have to see what the rates are like. As we've said all along, our testing program is very much linked to prevalence, what's going on campus, what's going on in New York City. And we don't have the crystal ball to predict where those rates will be come September. So you'll have to watch this space to see what the testing requirements are for the fall.
Well, great. Thanks everybody for participating, and I had fun if you didn't. So we do have a lot of questions. We've gotten a number ahead of time, and there's a number in the Q&A box. And I think one of the more common ones that I've seen, I'm going to ask Wafa to answer, which is to explain the difference between the 3 vaccines that are currently available in the United States, Pfizer, Moderna, and J&J, and is one better than the other? I know a number of people have said, I really want to wait to get Moderna, or I want to wait to get J&J. Wafa, could you help us answer this question?
Yes, and I will answer it first and then tell you why. I would say that I strongly advocate that individuals, whatever you're offered, you should be eager to get whatever vaccine that's available to you. I think it's really great to do so, and I'll tell you why that is. I think some people have looked at, for example, comparing the vaccine efficacy in the studies that have been done, and they look at the vaccine efficacy for the Pfizer-BioNTech vaccine is at 95%. The Moderna vaccine efficacy is similarly 95% or so. And then the J&J Janssen vaccine has an efficacy in the United States of about 72%. All of them are safe and no concerns, mild to moderate, only mild to moderate side effects have been reported. I think you should be very careful in comparing these efficacy numbers against each other. None of these vaccines have been tested head to head, meaning they've not been tested and the studies have not been tested where we compared one vaccine to the other. So it's very hard to know which would perform better. The other thing to keep in mind is the Pfizer and the BioNTech and the Moderna vaccine studies were done much earlier. As you recall, we had the results by November or so, and then the J&J Janssen vaccine, where the studies were done later. So the whole context in which these studies were done was quite different in terms of the epidemiology of the infection itself, as well as the circulating variants in the country and so on. So I would just caution people of making a direct comparison by looking at the individual results from these studies. And again, would stress the importance of just really, if you're eligible for a vaccine and offered a vaccine, to eagerly be willing to get vaccinated.
Thanks, Wafa. I'm going to turn to Melanie. Again, this is a question we got ahead of time, and then we'll turn to what's in the Q&A box. And this is about our Columbia testing program. So is the testing program able to detect variants in the COVID strain for those who test positive?
It's a great question. The lab we send to is not sequencing on their college program just yet. So the answer is no. So if we detect a positive, we will not know which variant it is. They are working with the Department of Health to do more sequencing. And in general, it doesn't actually matter what lab you send to. Commercial labs are not sequencing for the individual. So if you test positive, you generally don't hear, unless you're in a research setting, what variant you have. On a public health level, we look at population-based numbers to look at what percentage are of those variants, but the individual doesn't generally get that information unless, as I say, they're in the research setting. So we don't have that with our Columbia tests at this time.
Great. Okay, so Wafa, we have a number of questions about side effects. I'll lump two of them together. One is that the mRNA spike causes cancerous tumors, but a more general question is it possible that there are side effects that could appear years down the road from getting the vaccines?
Yeah, let me start with the first one first. And there is no evidence to suggest that the mRNA vaccines cause any tumors. So this is probably hearsay or rumor. The other question is about late side effects beyond vaccination. And what we know from other vaccines that have been used for decades and decades is usually side effects after vaccination occur early after vaccination. And that's very different from side effects from medications, where you could have side effects early, but you could also have late side effects from certain medications. So I think it's reassuring that as we're gaining experience with these vaccines, and the anticipation is that there are any side effects, they will most likely happen early on. I think it's encouraging that we've had now millions and millions and millions of people who've been vaccinated, have received these vaccines. And during at least the early phases after vaccination, we have not noted any unusual side effects. So if there will be side effects with vaccines, they usually happen early rather than late.
Great, thank you, Wafa. There are a number of questions that I'm going to also bundle together about where you live and what you are eligible to receive. And the way that it works now is that the allocation comes from the local health authority. The local health authority for us is New York City. And so that we will be vaccinating people who are residents of New York City. As of now, the vaccine that we believe we'll have available starting next week is Moderna. There's a chance it's Pfizer. We don't think there's a chance that it is Johnson & Johnson. But again, depending on the supply, this can vary from week to week. So what we do is, and it's consistent with what Wafa said, we schedule the appointments, and what we have available that day is what you get. Okay, we have a question. Actually, I'm going to turn to Jerry for a question about who is eligible for the vaccine. The question is specifically, will family members of Columbia affiliates be able to get the vaccine through the university? Jerry, we've got you on mute.
Yeah. Sadly, we don't establish the eligibility criteria. We're subject to the rules that are set by the state. And that means that by virtue of being a family member, you don't qualify for anything. If the family member is independently eligible because in the right age group or has an underlying condition, then absolutely yes, you're not disqualified by virtue of being a family member. But we can't stretch the eligibility rules based on family status.
Now, we will in Columbia Doctors be doing patients. So you do not have to be an employee of Columbia in order to get your vaccine in the 3 locations that I mentioned. So we are working on how appointments will be made and the hours and things like that. At Morningside, which Melanie will administer, those are Columbia affiliates only. Jerry, there's one question that's also related to the who is eligible category. Could you describe what educators, in-person educators, are in the 1B category? Is it just faculty, or are there other individuals who are in person that would qualify under that definition?
So unfortunately, the answer to this is that it really is faculty or in-person instructors. We've been carefully down this road and concluded that faculty doesn't need to be narrowly defined. If you're an adjunct faculty member, if you're a teaching assistant, if you're somebody who's actually in a classroom dealing with students, or someone who is soon going to be in a classroom dealing with students, you're eligible under 1B. There's a lot of effort underway to try and persuade the state to expand eligibility to include everyone who interacts with students, because an awful lot of people do interact with students who are not themselves instructors. But unfortunately, the rules are strict so far, and that's what we're trying to stay within. You need to be in some kind of instructional relationship with the students.
Great, thank you, Jerry. A couple comments in the box. One, yes, on my slides, I noted only a few of the medical conditions on purpose. I said including pregnancy is a 1B condition that allows one to be vaccinated, and hypothyroidism is actually not an eligible medical condition. Okay, so Wafa, we did answer this, but maybe we'll go a little deeper on the CDC guidelines that say no quarantine is needed for vaccinated persons. Actually, I think Melanie maybe is pulling her hair out on this one, actually. So we'll turn to Melanie. The CDC several weeks ago stated that no quarantine was needed for vaccinated persons after contact with a case. Have New York City and New York State formally adopted this provision?
Unfortunately, the answer is no. So even though this was announced at a Governor Cuomo press conference that New York State would be adopting this, we are required to wait for official written guidance from New York State Department of Health and then from New York City Department of Health. That has not yet happened. We don't have a time frame for when that will happen. So if today a vaccinated individual either comes in close contact with someone who is COVID positive or returns from travel, they're still required to follow the same quarantine guidance as anyone who is not vaccinated, understanding that their risk is probably significantly lower, but they still have to follow that same guidance. We have got that messaging up on the COVID-19 website under public health protocols and quarantine. And just as soon as that Department of Health guidance is updated, we will be updating our policies around that and following suit. Anyone who has been quarantined at the time and those guidance come up, we will retroactively release them. So they won't be required to serve out the full term of that quarantine. But for now, the answer is yes, you still have to quarantine.
Right. And we have a couple of related questions, particularly about travel and people who are vaccinated. So one is, can international travelers who are vaccinated omit quarantine prior to coming to CUIMC? Well, Melanie, I'll let you, I think you're on a roll with this.
So again, for now, travel has not been included in the list of omissions, even from the CDC. That was not included in the new guidance that came from CDC. So any returning traveler has to follow whatever the required CDC guidance is and the local guidance. So for now, coming back to New York, that would require a quarantine after vaccine. And again, the university complies with those same city and state guidance. So just be sure to check what those local requirements are wherever you're returning from.
Great, thank you. We have a question I'll answer, but without really giving you the content of what you would like to know, which is how will we get appointments to get the vaccine on campus? We're working on that right now. As I said, and one thing we're going to do is obviously start small so that we don't get overwhelmed. We don't know what our quantity is that we'll get from the city, and we need volunteers. We'll be sending out another notice. We're going to pull many of you who have been gracious enough to volunteer at the Armory. Many of you will be tapped to volunteer in some of our other locations. We do not, by the way, we've got a question about keeping a waiting list for people who are not 1A or 1B to get vaccines. I think this is referring to, at the end of the day, if you have a surplus, we're very careful both to try to predict volume and to not prepare the doses for any more patients or individuals than we know we have coming in. We can't go outside of 1A and 1B. We actually would have to destroy the doses, but we really try to do this in such a precise way that we don't run into that situation. And scheduling, there's a question about scheduling for the 60+ staff. We're working on that communication right now. You can go starting tomorrow to the Armory. So vaccinetogetherny.org is one way that you can get vaccinated literally as early as tomorrow, but all the other sites around the city will expand to 60 and over tomorrow. Okay, so a couple of other questions. Is there, Wafa, is there any evidence to indicate whether or not fully vaccinated people can unknowingly become carriers?
Yes, there is evidence that individuals who have been vaccinated can have been found to be, it's possible for them to be carriers, meaning to be infected without having any symptoms. That was noted in several of the studies as more data are coming along. In addition, also based on experiences now with people being vaccinated, there's accumulating experience as well that individuals who've been fully vaccinated can get infected and remain without symptoms. And that's the reason, again, that we have to remind everybody of the importance of for the time as we move ahead of masking and distancing and so on.
Great, thank you. Wafa, a couple of specific questions back to the question I asked you about the difference between the vaccines. We have a question, were all 3 vaccines tested against the variants? Is one part, and the other is, why does J&J only require 1 shot when the others require 2?
Yeah, I think the studies that were done, really, you have to look at when the studies were done and make an assumption in terms of what were the circulating variants at that point in time. So for example, there are several studies that have been, the vaccine studies that have been done recently in South Africa as one example. And although they didn't test everybody there, But nonetheless, we know that these studies were done at the same time when there was circulation of the South Africa variant widely in South Africa. And these studies were with some of these vaccines, some of the vaccines showed that there was efficacy by some of them in that context, which means that those two vaccines, and here I'm thinking of the Novavax vaccine as well as the J&J Janssen vaccine, they showed efficacy when conducted in South Africa during the period when there was circulation of these new variants. And similarly, also, some vaccines studies were done in Brazil, for example, in the context at the same time when there was the evolution of the variant that we recognize as the one that evolved in Brazil. So that's how we're making the associations between which vaccine was used and in which study and when was the study done and what were the predominant variants that were circulating at that point in time. Now, the second question was, the different doses, yes. So the doses that are selected for different vaccines really depend on what we call the early phases of study. These companies, what they've done in these studies is they measure the antibody response, the immune response after getting vaccinated, and they look at the level after one dose, after two doses, and they also use different amounts, different doses in and of themselves. And they determine based on these studies whether they go with two doses or one dose. So it really, they're looking for whether the dosing has induced a sufficient immune response. And based on this, they determine whether they need two doses or one dose.
Great, thank you, Wafa. Melanie, I'm going to turn to you. We touched a little bit on this in the explanation of the CDC guidelines, but here it comes. If you are on campus and you share an office with another person and both of you have been vaccinated, we'll assume double both doses, but you agree with each other that you're not going to wear masks, is this a violation of current university policy?
So that currently is a violation of current university policy. As we've mentioned many times, we look at all the guidance that comes from CDC, Department of Health. We meet frequently with the public health experts, and sometimes we set standards that are above those other standards for the broader safety of our community. So the other piece around that, in healthcare settings, and many of our folks who are all vaccinated are in a healthcare setting, these don't apply to healthcare settings right now. So right now, for all the reasons Wafa shared, we still recommend you remain masking. We know that people who are fully vaccinated can still get infected. They may not get severe disease. They may not end up hospitalized, but we still recommend masking and distancing in shared spaces. Obviously, as more and more people get vaccinated, we'll continue to examine those policies and adjust them as we deem safe to do so.
Great. Jerry, we have a question for you on return to office. And the question is, will return to office guidelines be dependent on whether employees are vaccinated or not?
So we're still working on a return to work policy. For the time being, it's the status quo. If you're working remotely, that's what you should continue to do. As we've said so often before in these forums, that we will give you notice before you come back. We're trying to figure out what is the best and safest way to get people back to work in the right numbers, taking account of all the considerations that need to be brought to bear on this. We have a group that is actively, energetically looking at the question of flexible work arrangements going forward when we get into this new era. But back to the point about the vaccine bears on all of this. It clearly is a factor that we're going to think about as we try to decide how many people can come back and when. But there's no direct one-to-one relationship. For example, there is no rule that says if you've been vaccinated, you should now come back to work, nor is there a threshold that we have to reach of vaccination before we'll bring everyone back. So please just consider this return to work issue a work in progress. There's so much that we don't know yet, so much that's still unfolding, and we'll be back. We'll give you as much notice as we possibly can. We know this is an additional source of uncertainty and even stress for people as they wonder what's ahead.
Great. Thank you, Jerry. I'll try to clarify it again. A number of questions about the geographic, where you live and where you get your vaccine. The easiest thing to remember is where you live is where you get your vaccine, with the exception of patient-facing employees. And so those are predominantly at the medical center. There are some obviously on the Morningside campus as well. But for somebody who lives in New Jersey, even if you're in an eligible group as defined by New York, that may not be an eligible group in your state, and you need to go to your state to try to get that appointment. Okay. Wafa, we have a question about the CDC guidelines, and in particular about children, because as we know, most children are not eligible to get vaccines, and if it's possible that even if you're vaccinated, you can transmit it. Should adults really be connecting with unvaccinated kids, even in their own household?
Yeah, I think that's a very good question. And I think we assume that people who are in one household are part of one pod, and they already are in contact with those children who are part of their household. So that would be, in reality, whether they were unvaccinated or vaccinated, if they're in the same household, they've been in contact with each other all along. So I don't see how that will make a difference. I think in terms of children and vaccination, there are ongoing studies, several ongoing studies actually, that are now looking at the efficacy, how well the vaccines, and the studies include both Pfizer-BioNTech as well as Moderna and J&J. Janssen are also starting some studies. Some are even going down to infant age children. So we're hopeful that over the next several months, we'll start accumulating data on the efficacy of these vaccines among children. There are data that are reassuring in terms of the fact that it's been noted that young children are less likely to transmit this virus. So that also is reassuring. So again, those are kind of a lot of different factors to take into consideration.
Great, thank you. Melanie, we have a question for you on vaccine availability for students. So as I said, at least the current prediction is that we might have enough vaccines to vaccinate everybody in the United States who wants a vaccine by May. If so, how would Columbia vaccinate the students, and how would they prioritize students?
Yeah, that's a great question. So much of that is going to be limited by the supply that we get in, of which we have no control. So certainly we're going to be going through the eligible categories. Once that door opens up and everybody is eligible, dependent on the supply, we will figure out the prioritization based likely on risk, and ensure that we can get through everyone in a controlled and orderly fashion as best we can.
Right. And it's possible that age might be a criteria. There are some states that are going by strict age criteria and keep lowering it. I believe Connecticut goes to 45 next month or within a couple of weeks. So they started at 75 and over, dropped to 65, 55, and then we'll move to 45 and not deal with the underlying medical condition. So it could be that we're still in a place where we're doing some age stratification. Our governor seems to be doing sort of a mixed model. Wafa, I'll turn to you because there's a number of questions about the efficacy of the Moderna and Pfizer vaccines on the new variants, and whether or not you think there is going to be booster shots.
Yeah, I think I actually anticipate that probably with all of these vaccines, potentially there will need to be booster shots. It depends how these variants evolve. And many of the companies are already developing new versions of the vaccines that will be available in the future. I think there's many now scientists and public health people believe that it is possible that this virus is going to require a seasonal, like we do with influenza vaccination, for example, that every year there's a determination of what are the variants that are circulating in influenza, and a vaccine is developed that essentially is tailored to those variants. So there's work already being done, and there's some vaccines that have already been developed that can potentially be used down the line as needed.
Mel, we'll continue, Wafa, with a question about a vaccine that hasn't been discussed yet, which is the Merck vaccine. This is the question: is the Merck COVID therapeutic, as hopeful as we have heard?
Oh, the therapeutic. Yeah, the Merck vaccines have all been abandoned. So Merck is out of the business of putting together vaccines for COVID. There is a potentially interesting new treatment. It's early on. It's in early phases of development. Data were shared about this new medication just in the last couple of days. So it's going to take a bit till larger studies are done to demonstrate the true efficacy of this treatment.
And then one more, and then I'm going to turn to Melanie after this question, Wafa. So the question is, new studies suggest that vaccinated people have a very low viral load. Hence, they cannot transfer the virus to others. The CDC issued guidelines based on this evidence. Why isn't Columbia updating its safety policies accordingly?
Well, I think, again, we are, the issue is that it might be true that it's lower viral load, but the question is that non-transmissible or not? That's the question that's at hand at this point in time. And there's research that's ongoing now to determine whether that's the case or not the case. In addition, there also are some of these big studies. The participants in these studies are being followed as well over time for a couple of reasons. One important reason is to see the duration of protection, because I can see that's another question that people have put in the Q&A boxes about the duration. We probably will learn more about the duration by following these participants in the studies longer. And then also, of course, it's going to matter whether there's an evolution of new variants, because that may also impact on how durable the protection is from these vaccines.
Great, thank you, Wafa. We're going to change gears a little bit and get back to these travel questions. So Melanie, with the changed CDC guidance for vaccinated individuals and the removal of a quarantine requirement for vaccinated individuals by New York State for out-of-state travelers, has Columbia campus access requirements been changed to conform with these changes for out-of-state travelers?
Great. So again, to emphasize, while we know this guidance is coming, it is not yet adopted by New York State. So there is no change currently to the Columbia travel requirement, the testing requirement, the quarantine requirement. Again, we'll continue to evaluate as the new guidance comes from Department of Health, but as of today, there is no change to the Columbia policy.
Great, thank you. Melanie, I'll ask you another one. Are security guards working in Columbia residential buildings eligible for vaccination as public safety workers?
So I believe that the new guidance that was just released is expanding the categories both on the public safety side and in terms of those who work in residential buildings to make them included in the 1B population. So I believe that is in place starting tomorrow. So if you're a New York City resident, then you will be eligible to receive the vaccine at a New York City site. Otherwise, at any New York State site, if you're a New York State resident.
Thank you. We have a question, which I'll try to answer. Is there a time frame when people age 50 will be able to be vaccinated? The answer is there is not right now, but again, I think we've seen the evidence. We started at 75 and over. That wasn't even in the first wave. Patient-facing was, and then we got to patient-facing in hospitals. We got to 75, 65, now 60, and we've only been in this world since December 15th. So I do think you'll see that happening. Wafa, there are a number of questions about pregnant women. Mm-hmm. And what is known about both fertility and the impact of the vaccine on that? And is it safe if you are in fact already pregnant to get the vaccine?
Yes, I will start first by saying that the vaccine studies that have been done thus far, all of them did not include pregnant women as one of the populations in those vaccines. So just like that, everybody's clear about that. I think the reason why both the CDC and the World Health Organization are both permissive and would like pregnant women to consider taking the vaccine is for the main reason is because pregnancy has been shown to result in that if a pregnant woman gets COVID-19, she's likely to have more severe disease and complications of COVID-19. So the risk is higher of complications among pregnant women. So I think that's the reason why the recommendation is for a pregnant woman to discuss with her provider and consider taking this vaccine to protect her from these potential severe effects of COVID-19. We don't have, as of yet, experience in terms of safety and so on, but this is happening. It's accumulating. There's also another study that's being planned to look specifically at the safety of these vaccines amongst pregnant women. In terms of fertility, we have, again, no study has been done to look at this, but there's no reason to believe that any of these vaccines would have, because of just the nature of the vaccines themselves, that these vaccines would have an effect on fertility. No biological reason to believe that they would have an effect on fertility.
Great, thank you. Melanie, a question, both you and Wafa, but let me toss it to Melanie and give Wafa a chance to catch your breath. How likely is it that fully vaccinated people who do get infected and show few symptoms will be protected from developing long-haul COVID symptoms?
That's a great question, and I don't think we know yet. I think, the gut instinct is they're unlikely to get long haul, but we don't really know that yet. And so I think we're going to have to follow those individuals closely to really see if that is true.
Yeah, and I think I agree with Melanie. I think what we know is for several of these vaccines, they've been shown to prevent severe disease. So that's important. But at the same time, there's evolving evidence now that sometimes even in people who've had very mild COVID-19 or even without any symptoms, that some of these individuals essentially show up with these long haul symptoms while they didn't have acute symptoms with that episode. So this whole area of long haulers and these long-term symptoms is an area of very intensive investigation now.
Great. Wafa, we have a question about the risk of anaphylaxis after the J&J vaccine. What is the likelihood? And also, is there a likelihood that you might need to miss work if you had that kind of a reaction?
Yeah, I think the data are actually accumulating regarding anaphylaxis, the severe early allergic reaction with the vaccines. And there's been several publications, and both by the CDC and also recent publication. And they show that it's about 2 per million individuals who are vaccinated. That's the rate at which these anaphylactic reactions have been observed. So it remains rare, but people are, everybody who gets vaccinated should download the app, the CDC app, and of course, we're trying to collect as much information as possible. So it's a rare event, and it appears to be quite similar between the Pfizer-BioNTech and the Moderna vaccines.
Great. Melanie, a question for you. How far after the May graduation are students eligible to get the vaccine?
We have always had a transition period for students that lasts after graduation. So it's not that graduation day comes and we cut students off. So we really do anticipate, particularly for our students who will still be locally, being able to include them in those vaccination plans through May, hopefully June, and potentially longer. So more to come on that, but there certainly won't be a hard cutoff in mid-May for our graduating students. There'll definitely be a window period to include them for vaccination.
Great. One more question, and then I'm gonna try to wrap up. Wafa, this is for you. When will we be able to know for how long vaccine effectiveness will last?
I think this is going to be, again, is one of those questions that's going to take time to answer. Like I mentioned before, all the participants in the studies are being followed long-term to see how long, how durable the protection will be. So that means that all the people in the Pfizer, BioNTech, Moderna are being followed up, and the J&J, all of them are being followed up. And people will be observed over time to see how many of them developed COVID-19, to find out how durable the protection, but they're also getting measurement of their antibodies in their blood to determine, again, what is the decay of these antibodies over time. So it's going to take a while for us to really be able to answer that question. And like I said before, the durability of protection may also be influenced by evolving variants. And if variants evolve that can outsmart our vaccines, that certainly might shorten the durability of protection.
Great, thank you, Wapa. I've been jotting down, there's a whole cluster of questions that relate to when, where, and how would you get eligibility for the vaccine in the coming weeks. And so let me try to summarize them. As of during this week, if you are 60 and over, you can schedule an appointment at the Armory or at any other city location. Right now, neither the Morningside campus nor the CYMC campus, separate from the Armory, can schedule appointments. So that's number one. Number two, the vaccine dose you will get at the Armory is Pfizer. That's the only available dose. Excuse me. We've gotten questions about volunteers. You will be able to volunteer at the vaccine sites, and one of the benefits of being a volunteer is that after a certain number of shifts, you are eligible to get the vaccine. So for those people who are asking questions, what do you do at the end of the day? One of the things we do at the end of the day is we vaccinate our volunteers. So it's a wonderful incentive, as well as the satisfaction that you get. Within the next day, you will be getting a campus-wide email that talks about, when we open, where we're opening, for what hours. A number of people said, are you going to be doing it 24/7? The answer is we are not going to be doing it 24/7. It will look much more like normal office hours. We will be serving, as I said, not at the Morningside campus, but at the other locations that I mentioned, 168th Street, 51 West 51st, and 103rd and Broadway. You do not need to be a Columbia affiliate. So to the question Jerry answered about, are your spouses eligible? Your spouses are eligible, not by virtue of their employment, their relationship to you as an employee or a student, but they're eligible if they fit into the 1A or 1B category. And finally, we are looking at expanding outside of New York City. So it could be as soon as April that we have a Westchester site. And that way, for those people who are in Westchester, we would be able to serve you. But the population we're serving are New York City residents, again, meeting those 1A and 1B categories. So we're at 5 o'clock. I hope you learned some things. I know we didn't get to all of the questions, but thank you. And those also inform how we build our FAQs. And a reminder, we'll be back here in 2 weeks if you'd like to get the latest updates and get some of your questions in. So thanks to all of our panelists, and we'll wrap up now.
Thank you.
Bye, everyone.
Thanks. Bye-bye.